Lenawee County is now moving from planning to action when it comes to opioid settlement funding after more than 2 years of study, data collection, and public input. The Bridging the Gap Subcommittee is recommending how to spend up to $1.5 million on programs aimed at substance use disorders across the county. The plan is built on a community needs assessment that combined local data, national trends, and direct input from residents and service providers.
We utilize local data, national data, needs assessment, and summary and recommendations. If you recall, at the board meeting, it was presented in November of 23 about a lengthy presentation of what was discovered. Along with that, we also had a town hall meeting and 2 book reads in the community to bring awareness to substance use disorder and to get a feel from the community of what was needed.
That data shows a major shift in drug use locally.
77% of these drugs were stimulants, including methamphetamine, cocaine, and crack cocaine, which was different than what had happened 5 to 7 years ago, and that was found in the community. 9% were opiates and narcotics. So of the opioid settlement funds, we were starting to call this substance use disorder as because the drug started to change and what was seen in the community.
Officials say that shift reflects broader trends moving away from prescription opioids toward illegal substances like methamphetamine and cocaine. Early discussions focused on recovery housing, but the committee ultimately moved in a different direction.
With the information and what was happening in the community, it was recommended that we create a recovery housing committee. That committee was appointed. It began in February of 24. We brought in 6 different housing groups that deal with people with substance use disorder. And the committee, at the end, after listening to the housing groups, did not want to move forward and fund recovery housing. The committee wanted to come up with what are the gaps in the community? What did the community needs assessment not meet? And what was needed best served in Lenawee County?
Instead, the focus became identifying gaps in services and building a broader response system.
The focus that we placed on is because initially the previous group had a focus on housing, and it became apparent that that was not a direction that we were going to move forward with. Jim started then the Bridging the Gap Committee, and I picked it up in July, I think, or August. Had to hit the ground running, get to know the team, but it was clear that people wanted to make sure the resources were being committed in any way possible so that we're connecting people who can bring help to people who needed help.
The committee reviewed 27 proposals over 7 months and is recommending a mix of programs covering prevention, treatment, and recovery. Catholic Charities for their parent support programming, Parkside Counseling for multiple youth and adult programs, U-Turn Health for virtual recovery support, Family Medical Center for medication-assisted treatment, Impact Marketing for county-wide awareness campaigns, Inmar for medication disposal kiosks and mailback, McCullough Vargas for peer recovery expansion, the Sheriff's Office for jail-based treatment and education.
There was a recommended programs for a holistic approach that was best served Lenawee County. For the monies that has been received thus far, 1.5 million was allocated in this rounds of RFPs.
Altogether, the recommended programs come in just under budget. The committee also made several strategic decisions about how that money should and should not be used.
The next thing is we were pretty confident we did not want to invest money in bricks and mortar and that kind of thing, and medically assisted treatment, which some of you may not know, there's certain drugs available that if you have an addiction issue of some kind, these things can blunt the effect of medication or of the substances for a number of days. Some of them are quite cheap, some of them are quite expensive. But there's been an issue with finding funding for that. It was obvious that was a component that we were going to need to look at in some form.
Instead, the focus is on services people can access immediately.
Understanding that we have some people who are school age, some people who are out of school, some people who have insurance, some people who don't have insurance, some who are justice involved, some who are not. There's a whole range of issues. And then, of course, their family members who have another host of issues. So trying to find a way to plug all those gaps in a way that we haven't had the resources to do before has really been our challenge.
One major takeaway: services don't work if people don't know about them.
Something we don't think about, but we have existing programs plus new programs, but they're no value if people aren't aware of their existence. So we realized that some kind of marketing campaign was going to be important and play an important role in this.
To manage the rollout, the committee is recommending a negotiation team to finalize contracts and then monitor the results.
We also understand, however, with humility, that this is our first attempt at this. I mean, we have $1.5 million that we're working with now. This is kind of our prototype approach. We're praying that we get a 70 or 80% success rate. But to make sure of that, that's one of the reasons that we're looking at reconstituting the Human Services Committee, because we need an entity for these groups to report out on their progress. And we didn't think the Bridging the Gap Committee was the right entity for that.
A restructured oversight group is also expected to track performance and outcomes.
So that was something that was apparent in the RFP and hopefully will be in the contracts as well, as that sustainability, because that accountability and reporting is going to be important of, is this going to be sustained? And I believe Commissioner Collins asked that several times. What is the sustainability going to be in this program?
Although not everyone was ready to move forward immediately.
I think my request is simply to see the proposals that are being requested to be funded so that I can understand their measurables, so that I can report out to my constituencies what that's supposed to look like. And so I don't think something that's taken almost 2 years is harmed by allowing those proposals to be disseminated, of the recommended proposals, and allow us to read those so I can ask questions. I'm not trying to second guess the committee. I'm not trying to say that they're right or wrong. I'm just simply saying I'm looking at a third of the funding going to one agency, a private agency, unlike most of the other ones, which are all nonprofit agencies. That knowing that owner of that agency and the size of that agency, that probably makes up a 50% of their total budget, maybe. I mean, that's a huge increase to a small little agency. And so I just want to know how they intend to track parameters like outcomes, which has been something they've struggled with in other programs. So I'm curious, as a person who's about to approve a $1.5 million of funds to a private company.
Others argued delaying would slow down urgently needed services.
I understand that, David. One of the, and I'm not sure about waiting. I mean, what time period are we looking at here that you need? A month to take a look at it? Because the one thing we do want to do is, this money's been sitting here for how long?
It's been slowly trickling in over the last 1.5 years, 2 years, probably.
Yeah, we just want to get this thing up and moving, because we've, had that one committee for housing that took up 12 months, and then we've appointed this committee that's taken another 12 months. But, and I think part of what you're looking for here is the evaluation, and recommends that those aren't in their contracts, are they? How you're going to measure it? Isn't that part of the negotiation of the contract?
Well, that's it. We have their proposals, but then we need to go back with them and negotiate things like, okay, you wanted $200,000. We're not going to give you that up front. We think that should be distributed to you quarterly, and that needs to be added into the contract, the final contract. One that was $45,000, however, which includes kiosks and mailers and Sharps containers. Of course, that would make more sense to fund up front, because virtually all their money is going into hard deliverables. So because each one has those vagaries, we thought it might make sense to have a team of commissioners and Administrator Murphy resolve those final details while staying inside the budget approved here.
In the end, the committee voted to move the recommendation forward.
So we have a motion and a second on the floor. All in favor signify by saying yes.
Yes.
All opposed, no.
No.
Motion carries. Thank you.
The final decision was then moved over to the Lenawee County Board of Commissioners meeting, where the approval was finalized.
Next item of business is the Bridging the Gap Opioid Subcommittee recommendation. The request yesterday, it was recommended that the Lenawee County Board of Commissioners approve the funding of selected Bridging the Gap programs not to exceed $1.5 million and authorize the designated negotiation team to finalize agreements. I so move.
I have a motion by Commissioner Morris, supported by Commissioner Blanco. Discussion. Hearing none. All those in favor signify by saying yes.
Yes.
Opposed, no. Motion carries.
With that approval, Lenawee County now moves into the implementation phase, where contracts will be finalized and programs will begin rolling out across the community. Officials say the focus now shifts to accountability, tracking outcomes, measuring impact, and making adjustments as more opioid settlement funding becomes available in the coming years. For now, this marks the county's first major step in turning settlement dollars into direct services for people struggling with substance use disorder. From the Lenawee County Courthouse, I'm Brian Vish for WLEN, Lenawee's local news station.